What you got?
All right, I'd
What's
like to do some waiting room topics, some questions from the waiting room.
Oh, I love me some questions from the waiting room. They're always pretty good.
You
Always
never
pretty
know what
good.
you're gonna get.
Yes.
So these things that they'd like to ask their doctor or their therapist, but they don't feel comfortable. They're a little shy. They don't know if they can ask them. So I thought I'd
Yep.
throw that.
Yep. Yep. That's what we're here for.
All right, this
Uh,
one's fun. Is it bad if I never dream?
Is it bad if you never dream? Not necessarily. Dreaming usually stems from REM sleep. And when you sleep, there's a few stages of sleep. You got non-REM and then REM. And REM just stands for rapid eye movement sleep, or rapid eye movement. And REM sleep is a time when your body is paralyzed. Like, so you can't move your body, but your eyeballs move when you are sleeping. And we think that a lot of dreaming happens during REM sleep. So if someone's not dreaming, sometimes that can mean that they're not having as much REM sleep, perhaps, or perhaps they're taking a medication that might be suppressing it somehow, um, uh, or they're not sleeping enough to get into enough REM sleep where they remember. Another kind of neat thing is if you wake up in REM sleep, you might be dreaming at the time and remember what's going on. But if you don't wake up in REM sleep, then perhaps you're not recalling your dreams that you had had throughout the night. But other than REM sleep, there is non-REM where you have the deeper levels of sleep. And when I mean deeper, like where you're really sedated, quite tired, compared to REM, your brain waves are just nearly awake. If that makes sense. Like, say this is awake, this is your eyes shut, this is, REM sleep and some dreaming. The deeper sleep is usually part of the non-REM, which is important too, and you can dream in that state as well. But if someone's not dreaming, then that would all have to be analyzed, and oftentimes you can get a sleep study where it shows you what percentage of REM sleep you're getting as opposed to non-REM, and usually that number should be about 25% of your sleep. Your total sleep time should be REM sleep. Sorry, I'm going on and on about this. This is probably more than this person bargained for, but no, I don't think that makes them.
There's nothing wrong with them if they're not dreaming.
Yeah, if they feel rested in the morning.
They're not boring. They don't have no imagination.
No, yeah, right. They're not boring. Yeah, that's correct. Now, some people in our clinic, they'll be having recurring dreams, and we will ask them about that. Like if you're dreaming about glass in your mouth or your teeth breaking, that's often related to anxiety, right? Some folks have, dreams of people chasing them, and that can be related to anxiety. Some people with PTSD have recurring dreams of the past trauma, and it's popping into their dreams each night, and it's very disturbing, and it causes like a physiologic response of heart racing and sweating and all that. And then there's just normal dreaming. On top of that, there's folks who have dreams because they're taking something like Seroquel or trazodone, so it enhances their dreams, and they're very much deeper dreams. And there's one last thing too, just since we're on the topic of dreams. Some folks, when they're dreaming, they'll have a wish fulfillment dream, like they're having a dream of something they want to have happen, and that plays out in their dreams. I don't know, dreams are pretty cool.
Pretty cool.
Yeah. All right, that's enough. I don't know if I can say more about not dreaming or not.
All right.
Yes.
So many more topics than dreaming. Well, let's move on to something different.
All right.
So let's say this is kind of a challenging one. Should I tell my children about my mental health issues?
Should I tell my children about mental health issues or about
my mental health issues? Should a parent share that with their children?
That's a good question. Obviously, the answer would be at certain times, maybe a kid would need to know. I think if it's couched within the self-care, like mommy's going to see her doctor today, so she feels good, or so she sleeps well, that type of thing. then a kid might need to know, like, where's mommy going? Generally, I think it's good for kids to feel secure with their parent and that their parent is stable and can take care of them and will be there for them. And if someone's having a mental health like problem, that might stir up a kid's mental health as well, right? Also, kind of kids know what's going on. I think they have a good meter for what's true or not as they get older. And sometimes I think it's best just level with kids in a straightforward fashion. But that's a difficult to answer thing depending on like the kid's age and depending on what the mental health problem is.
Mhm.
If it was like someone who was dealing with schizophrenia, that's when folks can hear voices speaking to them, and they might have like low motivation to get up day to day and to complete things. That's part of the syndrome. So, there may be a time and place to talk about that. I kind of think like if a kid's a teenager, they may need to know if it's impacting the teenager's routine or why a parent couldn't take care of the kid that day. Say if someone had like custody issues and a parent was like disabled somehow, yeah, then the child may need to be told like, hey, daddy still loves you, but is having a rough time and, needs to see the doctor type of thing.
The patient is kind of struggling with how to share that with their children, whether they're young children or adult children, teenage children. Is that something that providers are kind of prepared to give them tips on how to start that conversation?
To me, it's a case by case basis. And generally, I wouldn't share that with the child unless it was impacting the child somehow or affecting their schedule. And then I would just keep it in positive terms as in terms of self-care, but also that's, I'm a parent. I have two little kids and you're learning all the time who your child is and your relationship with them. And, like my daughter asked me the other day, is God alive or not? I like put down my Diet Coke and so really, that's just what we're going to talk about now. Like, I don't know. So sorry, I don't have a great answer for that one.
That's a hard one. There's
That's a hard one.
never a perfect answer for these.
Yeah.
All right, let's see if we have any softballs. What is the difference between normal behavior and disordered behavior?
Yeah, disordered behavior is probably breaking from the norms. But as I'm saying that, sometimes breaking from the norm is what advances civilization. For example, we think that people who were world travelers and like searched the 7 seas and came to the Americas, things like that, were folks who had ADHD genes, who were just restless, who wanted to go take risks and things like that. So, like space travelers, is that normal behavior to put yourself in space with cosmic rays and a possible certainty that you would be maimed somehow or die? So there's that. Now, if you're thinking about like the classroom and, a child in this case being disruptive and what's normal or not, when you look at ADHD, if a child has attention deficit disorder, they can't focus on one thing and their bodies may want them to move around and wiggle around and stuff. So there's probably a point where, there's normal focus and attention, listening to what the teacher's saying. And then there's this mild symptoms, moderate or severe symptoms of like not sitting in your chair, daydreaming, simply can't focus, and also moving around a lot, perhaps, carving out their desk and etching their name into it, something like that, because they're just bored and they're hyperactive. And we think kids are hyperactive because developmentally maybe they don't have enough stimulation chemically in their brains so they seek that behaviorally. So when you use a medication to stimulate them chemically, an exogenous medication, like you take Ritalin, put it, you ingest it, and that's like stimulating your brain. What do those kids do? They don't like become hyperactive. They're able to sit down and focus if it works well, And again, I'm not saying all children should be medicated. Don't get me wrong here, but just understand the answer to the question. So it kind of shows that here you got a kid who is having, I guess, abnormal behavior because they couldn't sit still. And when I think about this, I'm thinking about a child who's very much impaired in class, who's disrupting other students, who can't contain themselves, Arguably, kids in the moderate to mild level, is that normal? Could they just be tired? Did they not eat that day? Are their parents yelling at home? There's lots of other things that might cause, a departure from normal behavior. Yeah, this is a hard question because who am I to say what's normal, right?
You've got some credentials. You can.
Yeah, but then there's cultural things. It's like, is it normal to live with your parents till you're 40, like an Italian man living in downtown Rome? I don't know. I don't know. Nothing against the whole peninsula of Italy there, but so there's cultural things that are different, and sorry, I'm just rambling here, but because this is questions from the waiting room. In some cultures, they deal with mental health issues differently. They might grieve differently. People might express symptoms like more somatically who are having grief or depression or anxiety. There's certain names for these things in different cultures. I can't recall them all off the top of my head, but I know that they exist. Whereas here we would say, oh, you have generalized anxiety or you have clinical major depression. In another country, they may not call it that. They may kind of more normalize it to some extent. Anyways.
But I appreciate you sharing your expertise on these.
Thank you. Yeah, sure. Any more questions from the waiting room?
All right. I think my doctor should know about one of my past experiences, but it's hard to share. I've written it down, but it's several pages long. Is it appropriate to share with my doctor rather than having to retell it myself?
That's a very good question. My answer is to tell the doctor in those situations, there's something I have a hard time talking about, and I would verbalize this, that is distressing to talk about, something that happened to me. And I would reassure the patient that they don't have to go into all the details. Maybe they can just kind of nudge up against the topic, like how old they were, was it abuse of some sort, was it something they witnessed, and then develop trust with the doctor and move forward. I'm careful about written information. If someone wrote something down and that they fell out of their book bag or something, I wouldn't want that out there for them. Now, if they handed their doctor an envelope with something written down, said, please read this because I can't verbalize it, it's too distressing. Okay, one could do that, and that's not incorrect, I don't think. But I think it's good to discuss it in person and verbally, and just to know that a patient can tell as much or as little as they feel comfortable talking about. And I never push somebody. I try not to push people too much if I sense that it's distressing, or if they tell me this is really distressing. A lot of times patients will put a hand up. They're like, well, yeah, doc, I don't want to go there. And I'm like, okay, I get the signal. I know you don't want to talk about that. Now, there's sometimes part of therapy is like you got to talk about some of these things over time if you're doing psychotherapy for that traumatic thing that had happened, because it's common for people to avoid distressing thoughts or topics. So part of the pathology of trauma is like you don't want to talk about it, right? So it's not unnatural in this case for someone not wanting to share it with their doctor. But if you're doing trauma therapy, there's going to be a time where the doctor might ask you, or the therapist might ask you to recall the distressing thoughts and to process them in some form or fashion. Yeah. So hopefully that gives some little guidance.
That was very good.
Yeah. Well, clinic's starting up again. It's in the afternoon here. That was great. I had a lot of fun with this one. You know, I guess I will see you next week for questions for the waiting room then.
Yes, sir. We'll see you then.